Welcome back at 7:14. After an injury or an illness, getting back to everyday life can be a challenge. But Frannie Bienvenu, a clinical occupational therapist at Touro Rehab Center, joins us to discuss how occupational therapy, can help you get back into the swing of things. Good morning. Thank you for being with us, Frannie.
Well, good morning. Happy to be here.
So let's talk about how occupational therapy helps people rebound after an illness or an injury.
Well, at Touro Occupational Therapy, we focus a lot on helping somebody regain their independence, like after a life, like a health-changing event, you know, like a neurological injury, like a stroke or a head injury, or a surgery, like for breast cancer. So we help them get back to their daily meaningful occupations.
And how is occupational therapy different from physical therapy? I'm sure people at home are thinking, well, if you get hurt, you go to physical therapy. How are these two types of therapies different, but both necessary and sometimes together?
Absolutely, absolutely. Well, and occupational and physical therapy actually really do work hand in hand. Like we work very much as a team approach. And so physical therapy, most people are more familiar with PT, and they work on posture, they work on balance, they work on strength, mobility, like you think about like walking.
Right.
And occupational therapy also does address a lot of those same tasks, that mobility, that balance. But what we do is we put that mobility into function.
Gotcha.
So again, things like bathing and dressing, and if somebody needs to, wants to return back to meal preparation, being able to move within the kitchen to be able to perform those tasks more independently.
And you mentioned the people who would more qualify for occupational therapy versus physical therapy, or sometimes who would need both. And you mentioned patients who've had strokes,
yes,
major surgeries, and you mentioned stuff that people forget that you sometimes have to relearn to do. You take for granted.
Right,
being able to dress yourself, bathe yourself, cook, button a button. And so you all work on all of those small or big tasks with someone who's lost that function because of a number of reasons.
That's exactly right. That's exactly what we do. And so what we do is we listen to the patient. We listen to what are their goals, whatever they are telling us about what their meaningful, purposeful activities are for that day. So whether it is your basic self-care, like being able, like you mentioned, be able to button buttons or to be able to tie their shoes, but also even going bigger. We have some young patients that have had breast cancer, and we're trying to work on them improving their range of motion so that they can pick up their children again, so that they can just reach overhead in a cabinet to be able to get items. So it's everything. It's like the physical, it's the cognitive, it's the emotional, it's all those aspects of somebody's daily life.
And Touro has a pretty strong reputation, great reputation for occupational therapy in the community. Talk about the program, and what about the program at Touro sets you all apart?
Well, we are pretty well known for having a very comprehensive rehab programs, both inpatient, outpatients. We have a lot of experienced therapists, myself included. I've been at Touro for almost 35 years, which is a long time. But we love working at Touro. We love what we do for our patients. And I think what's most important is we look at our patients as individuals. It's like we listen to them. It's a very personalized approach. We listen to what is important to them, and then we provide the appropriate therapy.
We've run out of time. I want to ask you more questions. We run out of time, though. But if people at home have more questions, they want to maybe look into your programs or your services, how can they find out more information?
All you have to do is actually just look on our website. Like you just look at either LCMC or Touro. Like we have a lot of support groups. Support groups are wonderful for all of our neurological, stroke, caregiver, education, as well as a lot like cancer rehab, cancer survivor support groups. So we have it all. So just look on our website.
Well, Frannie, thank you so much for your time this morning and for all you've been doing for a little while, for 35 years.
Just
a few years. We appreciate your time this morning.
I appreciate that. Thank you.